Imagine walking into the clinic, confident you've done everything right, only to hear the doctor say, "We need to repeat the blood test because the sample isn't usable." That moment feels like a wall of frustration, especially when you've already set aside time and maybe even taken a day off. Do you ever wonder why a simple blood draw can sometimes turn into a costly repeat? Studies show that over 40% of seniors unintentionally sabotage their own tests, leading to extra visits, higher bills, and delayed care. Stay with me for the next 15 minutes and I'll reveal the 10 hidden mistakes you might be making, plus the exact steps to avoid them so your next blood draw is perfect. I'm Dr. Ana Martinez, board-certified internist with 25 years of experience caring for older adults. I've watched the same avoidable errors repeat themselves again and again, and today I'm sharing the science behind them. Blood tests are the window into how your heart, kidneys, liver, and immune system are functioning. When that window is smudged, doctors can't see the true picture. Age brings slower metabolism, medication interactions, and sometimes memory lapses, factors that turn a routine draw into a diagnostic challenge. We'll walk through each mistake, understand the biological reason it matters, and give you a one-sentence action you can apply today. Mistake 1, skipping the fasting period. When you eat breakfast before a fasting blood test, glucose and triglyceride levels spike, and the lab can't differentiate between a normal post-meal rise and an underlying metabolic disorder. Inside your body, food triggers insulin release, which pulls sugar out of the bloodstream and stores it as fat, masking the true baseline. The fix is simple: fast for 8 to 12 hours, usually from dinner the night before until after the blood draw, and only sip water. Mistake 2, forgetting to stay hydrated. Dehydration makes your blood thicker, increasing the risk of clotting in the tube, which can lead to hemolysis, where red cells break apart and release their contents, skewing many test results. Think of your blood as a river. If the water level drops, the flow becomes turbulent and the sampling equipment struggles. The practical tip is to drink at least 8 ounces of water an hour before the appointment, unless your doctor has told you otherwise. Mistake 3, ignoring medication timing. Certain drugs, especially blood thinners, cholesterol-lowering agents, and vitamins, can alter lab values dramatically. For example, taking a high-dose vitamin C supplement on the day of the test can falsely raise your iron levels, while skipping a blood pressure medication can cause a temporary rise in potassium. Inside the body, these substances either add to or mask the chemicals the lab is trying to measure. The solution is to discuss each medication with your physician ahead of time. Often a brief pause or a specific timing schedule is all that's needed. Mistake 4, using the wrong arm or squeezing the tourniquet too tightly. When the tourniquet is left on for more than a minute, blood pools in the arm, concentrating proteins and cells, which can falsely elevate markers such as white blood cell count. Imagine a garden hose pinched at the end. The water builds pressure and changes its flow. The remedy is to have the phlebotomist release the tourniquet as soon as the needle is in place, and to rotate arms for each draw if you have frequent testing. Mistake 5, not informing the lab about recent illnesses or vaccinations. An infection or a flu shot can raise inflammatory markers like C-reactive protein, leading the doctor to think there is an ongoing issue when it's just a temporary response. Your immune system releases cytokines that flood the bloodstream, temporarily altering the lab picture. The easy fix is to tell the lab technician and your doctor about any recent fever, cold, or vaccination so they can interpret the results in the right context. If any of those points surprised you, give this video a thumbs up. Your support lets the community know we're on the right track. What do you think about these common pitfalls? Let me know in the comments. I really want to hear your experiences. If this is opening your eyes to hidden risks, hit subscribe and join me for the next part where we'll uncover the remaining 5 mistakes that catch the most seniors off guard. Together, we'll turn those hidden errors into clear, actionable steps so you can walk into the clinic with confidence and get the answers your health truly deserves. Mistake 6, arriving at the lab dehydrated. Many seniors think a little dryness won't matter, but water is the medium that carries the nutrients and waste through your bloodstream. When you are short on fluids, the plasma portion of your blood shrinks and the cells become more concentrated. Inside the body, this concentration effect can make the lab see higher levels of hemoglobin, hematocrit, and even certain electrolytes, giving the impression that you have a condition such as polycythemia or an elevated sodium level, when in reality, the numbers are simply thicker because of dehydration. The simple fix is to sip a glass of water about 30 minutes before your appointment, but avoid gulping large amounts right at the moment of the draw, as that can dilute the sample. A moderate steady intake of water the day before and the morning of the test keeps your blood at its natural balance. PA so our cart and the bladebreed the bladsk eber so bake from midline, so the test keeps your blood at its natural balance. Do you ever forget to drink enough water because you're not feeling thirsty? Let me know in the comments, because staying hydrated is a habit we can all improve together. Mistake 7, taking high-dose biotin supplements or multivitamins that contain biotin without telling your doctor. Biotin, often marketed for hair and nail health, is a vitamin that can interfere with many laboratory assays that rely on biotin streptavidin chemistry. When biotin floods your bloodstream, it can bind to the test reagents and produce falsely low or falsely high readings for hormones such as thyroid-stimulating hormone, as well as for cardiac markers like troponin. In the laboratory, the test looks clean because the biotin blocks the signal, not because your body is truly at those levels. The remedy is straightforward. Stop biotin supplements at least 48 hours before any blood work that involves hormone or cardiac panels. If you take a daily multivitamin, check the label for biotin content and discuss with your physician whether a short break is needed. A quick phone call to your clinic can prevent an entire repeat draw. PA draw. If you've ever taken a supplement for a stronger coat of hair, this might be a surprise. Share your experience below. We can learn from each other's routines. Mistake 8, not timing your medication correctly around the test, especially for drugs that affect hormone or glucose levels. Many seniors take thyroid medication, corticosteroids, or insulin in the morning. If you have a blood draw after you've already taken your dose, the lab may capture the peak effect of the medication rather than your baseline level. For thyroid medication, the hormone levels can rise dramatically within a few hours, leading the doctor to think your thyroid is overactive. For corticosteroids, the anti-inflammatory effect can suppress markers that the physician is trying to monitor. The practical solution is to schedule the blood draw before you take your morning dose unless your doctor specifically instructs otherwise. In cases where a medication must be taken with food, discuss a short adjustment with your prescriber. Sometimes a brief pause or a shift to an evening dose for the day of testing can provide a true baseline without compromising your treatment. Pause. Ever wondered why your doctor asked you to come in early in the morning? That timing is often deliberate, and now you know the reason. Let me know if you've had to adjust your medication schedule before a test. Mistake 9, ignoring posture and recent activity before the draw. When you stand for a while, fluid shifts from the veins in your legs up into the central circulation, temporarily concentrating the blood. Conversely, sitting calmly for a few minutes allows the plasma to redistribute evenly. If you jog to the lab or stand in a long line, the lab may see a slight elevation in proteins and a decrease in plasma volume, which can alter results such as creatinine or albumin. The biological explanation lies in the body's effort to maintain blood pressure. Muscle contractions push blood toward the heart, changing the concentration of solutes. The fix is to arrive a few minutes early, sit comfortably, and avoid vigorous activity for at least 10 minutes before the needle goes in. Some clinics even ask you to rest for 5 minutes after the tourniquet is applied. Following that cue helps the sample reflect your true resting state. If you've ever rushed from a grocery trip straight to the lab, try a short pause next time. Does that feel doable? Comment below with your thoughts on how easy it is to incorporate a brief rest. Mistake 10, assuming every test requires the same preparation and not confirming specific fasting or dietary restrictions. A common myth among seniors is that all blood tests need an overnight fast. In reality, only certain panels, such as lipid profiles, fasting glucose, and iron studies, require you to avoid food and drink for a set period, typically 12 hours. Other tests like complete blood count, thyroid panels, or vitamin D levels are fine with a light breakfast. If you fast for a test that doesn't need it, you may feel lightheaded or even faint, which can make the draw more difficult. Conversely, if you eat before a test that does require fasting, the nutrients can temporarily elevate triglycerides, glucose, or iron, leading the doctor to think there is an underlying metabolic issue. The best practice is to review the order sheet with your pharmacy or call the lab ahead of time and ask, do I need to fast for this specific test? Write down the answer, set a reminder, and follow the instructions precisely. A quick phone call can save you from a misinterpreted result and an extra appointment. Have you ever been told to fast and then wondered why you felt shaky? That's the body reacting to low blood sugar, and now you know it was unnecessary. Share any confusing fasting instructions you've received. We can clarify them together. If any of these new points caught you off guard, please give the video a thumbs up. Your feedback lets the community know we're covering the right topics. What do you think about the hidden steps before a blood draw? I'm eager to read your comments and learn about the challenges you've faced. Now let's bring everything together. We've explored 10 subtle mistakes that can turn a routine blood test into a confusing puzzle, from forgetting to fast for the right tests, to taking biotin supplements, to the way you sit before the needle. Each mistake has a clear biological reason, and each has a simple, actionable fix you can start using today. By paying attention to medication timing, hydration, posture, and preparation instructions, you give your lab and your doctor the most accurate picture of your health. Take a moment to recap the key actions. Drink a moderate glass of water before the appointment. Pause biotin supplements 48 hours ahead. Schedule draws before morning medications unless told otherwise. Rest in a seated position for a few minutes. Then verify fasting requirements for each specific test. These steps are easy to remember, and you can even write them on a sticky note and place it on your fridge as a reminder. Remember, the goal of these blood tests is to catch health issues early so you can intervene before they become serious. When the sample is pristine, the results are reliable, and your doctor can make the best decisions for your care. You have the power to control the variables that are within your reach. If you found this information valuable, consider subscribing so you won't miss the next video, where we'll dive deeper into interpreting common lab results for seniors, turning numbers into actionable health plans.
Your support helps us keep creating content that empowers older adults to stay healthy and informed.
Thank you for watching, and until next time, stay proactive, stay hydrated, and keep asking questions about your health. Together, we'll navigate the lab maze with confidence and clarity. Take care, and see you in the next episode. Now, let's think about the next step you can take right after watching this video. Imagine you have a calendar on your kitchen wall, a simple reminder written in large letters that says water, no biotin, fast, sit calm. When the day of your appointment arrives, you glance at that note, take a sip of water, confirm that you have not taken any vitamin supplements, and allow yourself a few minutes of quiet before the nurse calls your name. That tiny routine, repeated each month, can shave away the need for costly repeat draws and give your doctor the confidence to act swiftly. You might wonder, what if I have a chronic condition that requires medication at breakfast? The answer is straightforward. Talk to your prescribing physician or pharmacist before the test. Often a brief pause of a few hours is enough, or the lab can schedule the draw at a time that aligns with your medication schedule. The key is communication, not secrecy. When you share the details, the lab can adjust the timing and you avoid the trap of an inaccurate reading. Another common concern is the fear of dehydration, especially if you are on diuretics or have kidney issues. The recommendation is not to gulp a large bottle, but to sip a moderate amount of water, about a half cup, about 30 minutes before you arrive. This amount is enough to keep your veins accessible without diluting the blood components you need to measure. If you have been told to avoid fluids for a specific test, follow that instruction precisely. Otherwise, a gentle hydration boost is your ally. Let's revisit the most surprising mistake we covered: the influence of the white coat effect on your stress hormones. When you sit upright, tense, or worry about the needle, your body releases cortisol, which can alter glucose and electrolyte levels. By practicing a brief breathing exercise, inhale slowly through the nose for 4 counts, hold for 2, exhale through the mouth for 6. You calm the nervous system and allow your blood to reflect its true baseline. It takes only a minute, but the impact on the numbers can be profound. Finally, remember that every lab has a reference range that is tailored to age groups. What might be flagged as high in a younger adult could be normal for someone in your decade. Bring a copy of your most recent results to the next appointment and ask the physician to explain any values that fall outside the expected range. This dialogue turns raw data into a clear health roadmap. If any of these tips sparked a new idea, please share it in the comments below. Your experiences help the community learn and grow together. And if you felt a moment of clarity while watching, a simple like lets the algorithm know we're on the right track, reaching more seniors who could benefit from this knowledge. Before we part, I want to leave you with a small challenge. For the next week, write down each step you take before a blood draw, no matter how small, and notice how it changes the ease of the process. You'll soon see that the power to improve your health outcomes lies in these everyday choices. Thank you again for spending this time with me. Stay curious, stay attentive to the details, and remember that a well-prepared blood test is a cornerstone of preventive care. Subscribe for more practical health insights, and together we'll continue unlocking the secrets to a vibrant, longer life. Until our next conversation, take care of yourself and those you love.